At this time, I'm pleased to introduce our first speaker, Katrina Holt. She's Director of the National Maternal and Child Oral Health Resource Center at Georgetown University. We're so grateful she's with us today to share an overview of oral health care access for pregnant women and an update on the impact of the ACA on options during pregnancy through Medicaid. Katrina?
Thank you, Catherine, and good afternoon. This is Katrina Holt. I'd like to start by thanking the Association of Maternal and Child Health Programs and the National Institute for Healthcare Management Foundation for hosting the webinar. In my presentation, I'm going to provide an overview of access to oral health care for pregnant women, share some barriers and strategies for accessing care, and highlight a few resources to support your efforts to improve access to oral health care. If you're not familiar with the National Maternal and Child Oral Health Resource Center, the project is funded by the Maternal and Child Health Bureau to support professionals, in particular those who are working in or with state maternal and child health programs. The Resource Center gathers, develops, and shares information materials to promote sustainable oral health services for the MCH population, especially for families with low incomes or with limited access to high-quality oral health services. Pregnancy is a unique period during a woman's life and is characterized by complex physiological changes which may adversely affect oral health. At the same time, oral health is key to overall health and well-being. The U.S. Surgeon General, the World Health Organization, and many other experts have all recognized that oral health is an integral part of health for pregnant women. And we know that preventive, diagnostic, and restorative dental treatment is safe throughout pregnancy, and it's effective in improving and maintaining oral health. In 2011, the Health Resources and Services Administration's Maternal and Child Health Bureau, in collaboration with the American College of Obstetrics and Gynecologists and the American Dental Association, and with the assistance from the Resource Center, convened an expert work group. The result of this work group was the publication, Oral Health Care During Pregnancy, a National Consensus Statement. The consensus statement presents guidance on oral health care for both prenatal care health professionals and oral health professionals. It can also be used to advance national and state policies to match professional guidance. Access to oral health care for pregnant women continues to be a challenge in the United States and is impacted by a number of factors. Some pregnant women and health professionals don't understand that oral health care is an important component of a healthy pregnancy. In addition, some pregnant women believe that poor oral health care during pregnancy is normal, and some with obvious signs of oral disease unfortunately don't seek or receive care. According to a recent survey that was conducted by the Children's Dental Health Project, 63% of pregnant women didn't know that it was safe to get their teeth cleaned during pregnancy or thought it was unsafe to do so. Other barriers that impact pregnant women's access to care include a lack of dentists willing to treat pregnant women because of perceived risks during pregnancy, a difficulty finding dentists participating in Medicaid, lack of dental insurance coverage, and pregnant women's inability to pay for care. Additionally, challenges associated with finding child care and getting time off of work, lack of access of transportation, and late prenatal care entry, all of these impact pregnant women's access to care. Although there is limited information about the use of oral health care during pregnancy, some data are available for some states. From data that was collected in 2011 as part of the Pregnancy Risk Assessment Monitoring System, or PRAMS, reports indicated that 38 to 57% of women reported going to a dentist or a dental clinic. 31 to 49% had their teeth cleaned during a recent pregnancy, and 15 to 31 reported going to a dentist for a problem. Given that nearly half of all births in the United States are covered by Medicaid, it's essential for women to be able to access oral health care through Medicaid to reduce both the mother's and the child's risk for oral disease. As the largest payer for maternity care in the United States, Medicaid has a very important role to play in improving perinatal health outcomes. Dental benefits for adults enrolled in Medicaid vary across the country, with states having the flexibility to determine what benefits to provide to enrollees. Furthermore, there are no minimum requirements for dental adult coverage. Most states offer some dental benefits, but less than half, of the states provide comprehensive oral health care. MSDA's 2014 National Profile of State Medicaid and CHIP oral health programs shows that there are 9 states where pregnant women have more dental benefits than non-pregnant adults. The profile provides current and archived Medicaid data, a state comparison tool, and other resources. This helpful tool of information and materials is available online, and individuals can register as a public user. So I encourage you to use this tool to find some helpful information in your work. In addition to Medicaid providing some dental benefits for pregnant women ages 21 and over for enrollees, it's important to remember that Medicaid and the Children's Health Insurance Program serve children and adolescents up to age 21. And children and adolescents, including pregnant adolescents enrolled in Medicaid and CHIP, have coverage for dental services, including oral examination, preventive care, and also treatment. With only half of women going to the dentist during pregnancy, there's a need for practical and meaningful ways to promote access to care. This slide and the next slide provide a few strategies, such as educating the public about the importance and safety of care during pregnancy, to integrate oral health topics into prenatal care topics that can increase women's awareness of care and their ability to successfully navigate the healthcare system, and also sharing of education materials that are written at a reading level that everyone can understand and act on these recommendations. These strategies build on the idea that pregnancy provides a teachable moment when women are more motivated to adopt healthy behaviors. And health professionals and community providers can also increase access to care by helping pregnant women complete applications for insurance coverage or social services for other necessary services like transportation. They can also provide a list of dentists in the community, including those who accept Medicaid, and contact a dental office or clinic to facilitate care. Other strategies for improving access to care for pregnant women including supporting the development of state perinatal oral health guidelines to promote current standards of care, to strongly advocate for Medicaid coverage to reduce financial barriers, and to support safety net dental clinics. Many states and communities are tailoring oral health literacy campaigns and using community health workers, case managers, and program staff to educate pregnant women about their eligibility for Medicaid dental benefits and helping to link them to care. And one final strategy is that obstetricians, nurse midwives, and family physicians can promote oral health since women are more likely to see a primary care health professional than an oral health professional during pregnancy. These health professionals can provide oral health education and help connect pregnant women to sources of care. The Maternal and Child Health Bureau is also a leader in promoting oral health and overall health for pregnant women. As part of the 2015 Title V MCH block grant application, states selected 8 national performance measures based on a statewide needs assessment. 30 states and jurisdictions selected National Performance Measure 13, which is the percentage of women who have had a dental visit during pregnancy. Many states and jurisdictions that have selected this measure are building and strengthening connections for working in partnership with state programs, dental schools and dental hygiene schools, private practice, community-based programs, and other entities to address access to care for pregnant women. To learn more about the National Performance Measure 13A, I encourage you to visit the Resource Center's website. addition to the Maternal Child Health Bureau, there are other federal agencies and national organizations that can support your efforts to promote access to care for pregnant women. A few of these resources are listed on this slide. For example, CDC's Pregnancy Risk Assessment Monitoring System is a good source for state-specific data on maternal oral health experiences before and during pregnancy. In closing, I'd like to thank you for listening to the webinar today and for your efforts to improve access to care for oral health for pregnant women. If you have questions related to the topic of oral health for pregnant women or related to services for children and adolescents, please do not hesitate to contact the Resource Center. We really look forward to hearing from you. Thank you very much.